Male breast reduction is an operation to try to reduce enlarged breast in men. It is a condition start actually during puberty. 75% of the boy aged 14 have bigger breast. By the age of 17, only 7% of them have large breasts. And then there is another group of men in their 30 and 40. When they put on a bit of weight, their breasts get bigger, and then later on in their 50 and 60, again as a result of their skin elasticity get lost, they have a bigger breast. There is two ways of doing this operation, either by liposuction or by open surgery. Each one have advantage and disadvantage. The liposuction have a very small scar and the patient recover very quickly, but if the breast have more breast tissue, it will be less predictable. It will remove more fat and less breast tissue. Open surgery have longer scar, longer recovery, but even if there is breast tissue, it can remove all the breast tissue, and even if there is excess skin. So it depends on the patient. So it's important. So I can see the patient first of all, I examine him and I offer him what I think in his best interest will be, which one he will benefit the most of. This operation usually done either as a day case or one night stay. It will last between 60 minutes to 120 minutes. All the stitches I use usually dissolve. I would say the majority of the patient having this operation will require liposuction. And after the operation, they have a bit of bruises around their chest wall, and all of them will wear a very tight pressure garment for 6 weeks. The recovery period between 1 to 2 weeks. A lot of the patients who I operate on are men who are very active, and they usually return back to full activity. By 6 weeks, they're back to do competitive sport. It's an operation do contain some risk. Bleeding could be a risk, but it's very rare. Infection could be a risk, mainly with an open surgery and less common with liposuction. The nipple sensation can change, and again is more likely with open surgeries than liposuction. They will always have scar. They have longer scar with open surgery. Quite difficult to get both breasts equal and symmetrical. And with liposuction, you may not expect to have completely flat chest except if you started with large breasts, but you will hopefully improve quite a lot after the operation.